So thank you very much, Catherine. And it was great to do this work together. I'm pleased to present this presentation about how is implementation of PACT going so far. Next slide, please. Yeah. National guidelines across the world recommend to intervene early in ASDM, early autism spectrum disorder with evidence-based practice. Improving the quality of intervention research over the past 10 years has led to the development of evidence-based therapies such as PACT. PACT is a parent-mediated therapy, as you already know. It improves parent-child synchrony at short term and decreases autism at medium term. However, one of the current challenges is to implement this type of evidence-based practice. Knowledge is one of the determinants of implementation and referred to by some authors as a precursor of implementation. There is two levels of PACT training for professionals. The first level is an introduction to PACT with an e-learning, and the second level aims to train professionals to apply PACT in their practice according to the manual. It's composed of 2 days PACT training and a supervision post-course for which the professional has to send 2 videos of PACT session with the parent. The professional becomes certified PACT therapist if this video have a high fidelity of the PACT. Then a professional can guide parents and empower them with the PACT techniques over 12 sessions as already shown in a large LCT. Thanks. Then 460 professionals were trained across the world. But the question is, and what after the PACT training, after the 2 days PACT training? So the aim of this study is to know how this implementation of PACT is going after the 2 days PACT course. There is different way to measure, there is different outcome to measure the implementation, as it was already said along this great day. There is acceptability and appropriateness. Also the adoption, what is how the professional have the intention, do action to try to implement the evidence-based practice. Also the level of penetrance, which is the number of cases seen in practice, the number of families who can benefit of PACT, for instance, and the level of feasibility of this practice for professional, and also the level of fidelity and adherence. There is numerous determinants or factors who can influence these implementation outcomes. They are generally divided in 3 levels: the national levels, which can be the national guidelines, for instance, the regional level, and the local level, composed of the organizational level and clinician level. We were more interested in organizations which are called proficiency organization because they can improve the implementation. And it's some organizations who have norms and expectations that clinicians prioritize improvement in client well-being and maintain competence in up-to-date treatment practice. The clinician level include knowledge, as we already said, for instance, PACT training, the 2 days PACT training, and also other characteristics such as attitude toward evidence-based practice that was also measured in this study. Because it's parent-mediated therapy, we can say that parents are the distal implementators. So we measure in the parents the same type of implementation outcomes, and also we're exploring the determinants. The methodology of this study was a retrospective cross-sectional study with a mixed method design. The data were collected via a survey. There were 2 surveys, a survey for parents and a survey for professionals. They were different, with a question who were adapted for parents and professionals accordingly. The 2 survey was sent to all the professionals who were trained during these 3 last years, so these 460 professionals, and they were asked if they can, and we thank all these professionals, if they are in this audience, to have responded. They were thanks to answers to this survey, and we also asked this professional to send the survey for parents to the parents who they have already trained, who are parents that were currently trained. The survey was in different language, in English, in French, in Italian, in Cantonese, and in Spanish. The survey was composed of a Likert question scale, called from score from 1 to 7, and there were also some short answers question. Thank you. Then, outcomes and determinants of PACT implementation in the survey for professionals. 232 professionals responding, so it's half of the population who were trained, which is great. The professionals were mostly speech-language therapists, secondly psychologists, and thirdly psychiatrists. These professionals were seeing family with child with ASD in practice with a median of 80%. They were working on public health center, which are camps or CMP or CESAD in France at 61%. And they were mainly working in an organization at 83%. 18% of them was manager. We asked this question because this role could have an influence of the level of implementation. What is important is that this population was telling that they were in organization with a high level of proficiency, with a median at 45 out of a cumulative score of 56. And all these professionals have also a high attitude toward evidence-based practice, with a median at 37 out of a cumulative score of 42. Thanks. So the implementation outcomes, what we can say is the acceptability and appropriateness of PACT was very high among all the professionals, with a median of 32 out of cumulative score of 35. The feasibility in practice was moderated, with a median at 4 out of cumulative score at 7. And these professionals say at 70% that they were trying to implement PACT. However, when we ask them about the number of families seen, the median value tells us that the professionals see 2 families per 14 months. And also, interestingly, 25% of them was certified. Thanks. So, we search we did a logistic regression model to look for the factors that influence to have seen 2 or more families over the 14 months with PACT. The overall model was significant and all the assumptions were fulfilled. One of the results was that more the professional had time since the training, more likely they were to have seen 2 families or more, what is logical. However, the time variable had a ratio of 1.07, which means that it wasn't the main explanation. Another explanation, more interestingly, was that professionals working for a public health center were 3 times less likely to have seen 2 families or more. Thanks. This result can explain some difference between the country. Families seen per professional has a median of 1 in France instead of 2 in Italy and UK, and 6 for Hong Kong. And the number of certified professionals was equivalent in France, Italy, and UK, but very high in Hong Kong. Thanks. So, what says a professional about the barrier they have to adopt PACT in practice in public health center. The major problem was time for parents and professionals. Professionals say that they didn't have time dedicated to the implementation in practice of PACT, and their organization didn't manage to reorganize their time and role in order they implement PACT in practice with families. Some professionals also say that they were not working with age-appropriate children population. And also, professionals say that implementation of PACT was not a priority of them and the organization. Interestingly, they also say that there were not enough professionals trained in same departments, which we can suppose could facilitate learning by co-support of professionals between them. Thanks. So what we can highlight from professional results is that PACT was highly acceptable and appropriate for all the professionals in their practice across the countries in the world. However, there was an heterogeneity in adoption and more in penetrance, which is the number of families seen in practice with therapies, even in a population of professionals with a high level of attitude toward EBT and a high level of proficiency of the organization. What these results suggest is that the network of public health centers can help to disseminate evidence-based practice, as we can see in France, where funds are largely distributed since a couple of years to upskill the professional, and where PACT was where professionals were largely trained. Were largely trained in France, as Thierry Maff and Adler Touré said. However, stakeholders should be aware and develop strategy to ensure that the trained professional can use PACT in practice for the benefits of the families. It could be proposed that they are systematically asked before to do the training about how they will be implementing PACT, with how many families, and how their role in their organization, and how their organization will allow them to implement PACT therapies. I give the speech to Matea Balanowski for the result about implementation for parents.
Hi, everyone. I'm gonna continue talking now a bit about the outcomes and determinants of implementation from the results from the parents. So basically, as Marie said, in addition to the survey for professionals, we did a survey to ask the parents what do they think about implementation in daily life. So we'll see the results now. We have responses from 100 PACT trained parents. And as we can see, there is quite an international spread. So we have parents who have responded from UK, mainland Europe, the US, Hong Kong, and other countries. And so it's a quite worldwide response to the survey, which similarly to the professionals consisted of part of quantitative questions, which were scored on a scale from 1 to 7, and part of qualitative questions, which were more open questions on what do parents think about implementation of PACT.
Can help to disseminate evidence-based
So we will move on now to the quantitative results. So these are the parent implementation outcomes from the quantitative data. This is basically these are those questions which were scored on a scale from 1 to 7. And here in the table we have the median values. So we can see that mainly the range of sessions that parents did is about 10, and parents find the PACT quite acceptable for the child. So they have scored 39.5 out of collective score of 49. They also find PACT acceptable for the parent, with a score of 35 out of a collective score of 42. PACT is also quite feasible to learn with a score of 6 out of 7, and it's quite feasible to implement in daily life with a score of 6 out of 7. And lastly, the number of times that parents use PACT per week is about 4 times per week, as we can see. So overall, this is the preliminary data from the quantitative part, and we can see that the results indicate quite a positive outlook on what the parents think in terms of some of the technical parameters of acceptability and feasibility. Now I'll move on to the outcomes from the qualitative data. So in addition to these questions, we also asked parents a bit more open questions, so we can see what do they think about, what do they find easy and good about implementing PACT in daily life, and what are some of the obstacles they face in implementing PACT. So we did a team extraction analysis. That's basically a qualitative analysis process where we see which themes reoccur and we identify those themes, and then we use them to see what are the most prevalent themes across all parents who have answered. And from the parents who've answered, we've clustered 3 broad themes, which act as facilitators for implementing PACT. These are improvements in the child, adult parent benefits, so direct benefits of the parent who has been trained in PACT, and some positive aspects of the PACT techniques and strategies that the parents learn. So moving on to the first main theme, this is the improvements in the child as implementation facilitator for the parents. So basically, a lot of parents have answered that they have noticed improvements in social engagement in their child and improvements in expressive communication. In terms of improvements in social engagement, a lot of parents have commented about how after doing PACT, they have noticed that their child is willing to engage more, initiates more play, likes turn taking, sharing, and is simply doing more social overtures with the parent. In terms of expressive communication, parents have also commented that they have noticed improvements in directed vocalizations, improvements in pre-verbal or non-verbal precursors, and they have also noticed increased amounts of directed eye contact and increased amounts of directed facial expressions. So all of these are behaviors and cues that the parents have noticed as improvements while doing PACT, and in addition to other improvements, including better play, so the children would play for longer, and also they noticed improvements in communication comprehension. And all of this together, so these improvements in the child, which were noticed after the parents have done some amount of PACT sessions, have acted as positive feedback mechanism in a way, and have reinforced the motivation for parents to implement PACT on a daily basis. Here we can see implementation facilitator for the parents being the well-being of the parents themselves. So a lot of parents have commented about how after doing PACT, they have felt upskilled and empowered. They felt like they've gained new tools in understanding how to play with their child and new tools in understanding how to communicate with their child. And this has had a direct positive effect on the parent well-being. Parents feel more confident, they feel more empowered, they feel more secured, which has also had a snowball effect in improving and strengthening the parent-child bond. So parents have felt closer to the child. And all of these things have also been felt to other members of the family. So not only the parent who has been directly trained in PACT, but other household members or the second parent have also felt benefits in generalization of these skills, which also has motivated parents to implement PACT on a daily basis. And the third implementation facilitator for the parents has been the PACT therapy on its own. So parents have really loved some elements of how the therapy is delivered and some of the techniques and the strategies. Mainly, it has been the parent training and the therapist guidance. So the parents really valued the time that they have spent with the therapist in reflection with the videos and the advice that they have had over the course of the sessions. And that has been very beneficial, not only in terms of learning new strategies, but also it has acted as an additional motivator and as an additional positive feedback mechanism to motivate parents to do PACT more often. So these three techniques overall have been, these three clusters overall have been the main implementation facilitators for PACT. So these three themes basically have really influenced and encouraged parents to practice PACT more often. And now we have some barriers for PACT implementation. So here we have certain graphs for what are some of the obstacles that parents have faced while implementing PACT. Firstly, we can see that some parents have commented that child motivation might be a barrier. So that's they just find it difficult to do PACT if the child is not motivated enough or it's not willing to engage in play at all. But also we have the larger chunk of this graph is actually the direct obstacles from the parents. And if we can see an in-depth analysis of those obstacles, the main barrier for PACT implementation has been time. So parents have repetitively commented that they don't have enough time to implement PACT on a daily basis. Also, especially parents who are single parents or who have working job, they found it difficult to take time to reflect on the videos while they have to supervise their child. And finally, here we have a graph about some of the differences among parents in quantitative adherence. That's basically how often do parents practice PACT on a weekly basis. And here we have a graph that displays data from France, UK, Hong Kong, Italy, and others. So we can see that mainly parents implement PACT between 4 and 6 to 7 times per week. But the only outlier here is parents in Hong Kong who do PACT a bit less with a value of 2 times per week. There are several reasons why this may be the case. Some of the influencing factors based on the qualitative data is the number of follow-up sessions and the time. So parents in Hong Kong have answered that they would have wished to have more follow-up, and that time was a big barrier for implementing PACT more often. This is actually quite interesting to see because, as Marie said earlier, parents in Hong Kong, professionals in Hong Kong, were the ones who actually saw most parents per professional. So mainly professionals in Hong Kong were able to see 6 families, unlike other international professionals who were able to see less, like 2 to 4. And even though professionals can see more families in Hong Kong practice PACT less frequently. And finally, this is just to appreciate the layered process of PACT implementation that has been undergoing. So we have several layers that we should be careful about. Firstly, training the professionals, so training the right professionals who would be able to deliver PACT, who would have time to deliver PACT in their practice, and also who are seeing age-appropriate children. Then also there is the importance of organization and how the importance of organization in public health and private sectors, the differences that they work in, and how the organization can provide the support and time needed for the professionals to practice PACT. There are also systemic level importances here that should be appreciated. And lastly, the parents, since this is a parent-mediated therapy, we should appreciate how the parents implement PACT in their daily life and how that leads to family confidence and the desired output in a way. So it is really important to know that real success in implementation, real success in PACT implementation can be only seen if we see success in each of these layers and each of these processes. Thank you.